We are used to it. The fast-paced, ever-busy world was forcefully put on snooze mode when the coronavirus contagion broke out. It was an illness caused by a novel severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, formerly called 2019 nCoV, first discovered in Wuhan City, China. Retrospective investigations by Chinese authorities identified human cases with onset of symptoms in early December 2019. SARS-CoV-2 was identified in early January and its genetic sequence shared publicly between the 11th and 12th of January. The full genetic sequence of SARS-CoV-2 showed that the disease has an ecological origin in bat populations.
COVID-19 has been on the lips of everyone ever since it was first reported in December 2019 out of Wuhan in China, and the World Health Organization was the institution that it was reported to as a new infectious disease that was rapidly spreading. And in under a couple of months, it had spread to multiple countries, just illustrating the fact that the world is indeed a global village, and with transportation, air travel, and high mobility of the world's population, within a few months, multiple countries had documented confirmed cases of COVID-19.
In Nigeria, the coronavirus was first reported on the 27th of February 2020 in Lagos State. Since then, the battle against the virus, which has infected more than 172,000 people, eventually claiming 2,134 lives, has been on. Masks were introduced, with state governments imposing lockdowns and restricting social gatherings. Washing of hands and the use of sanitizers gained prominence. Public spaces were closed, and many resorted to working from home in an effort to slow down the spread of the virus. But how prepared was Nigeria for this lifestyle-altering disease?
So obviously, this was a new infection. The capabilities for testing were minimal at the onset, but countries rapidly developed their capacity, including Nigeria, to test and confirm cases of COVID-19. So we knew it to be an infection that's transmitted through the respiratory tract, presenting as a respiratory infection. But as time went on, we started seeing other clinical manifestations, clinical presentations of the disease. And so while majority of those who are infected would be either asymptomatic or in mild forms of the disease, there's a certain proportion, and this varies depending on the demographics of the population affected, and clinical status, being previous history of chronic illness and certain risk factors. So the majority would recover from the illness. But unfortunately, even those who are asymptomatic and in mild forms of the disease can transmit the infection. And so that's knowing who would then be infected and how that individual would respond to the illness has been a very confounding issue all over the world. And so across the world, especially in the Western world, we're seeing increasing numbers of cases, increasing numbers of deaths, and an overwhelming of health systems. So when you see an overwhelming of health systems in countries that had somewhat strong and robust health systems in place, then you can understand the concern early on in the pandemic for countries in the developing world, lower and middle income countries, and how they will be able to manage the outcomes of the pandemic. So fortunately, in Nigeria, with the Federal Ministry of Health and Nigeria Center for Disease Control and their experience in tackling infectious diseases, generally diseases like Lassa fever, cholera, measles, cerebrospinal meningitis. At least there was a strong response to COVID-19. There was a rapid increase in the number of states that built and developed capabilities to test and confirm cases of COVID-19 across the country.
The Nigeria Center for Disease Control, the NCDC, said prior to the confirmation of the first case in Nigeria, it's begun working with states and hospitals to map out and establish isolation and treatment centers for managing COVID-19 cases. In addition to this, the NCDC says it began training health workers across all states on case management, infection prevention control, surveillance, risk communication, and other areas of epidemic preparedness and response. As of March 22, 2020, the initial 30 confirmed cases of COVID-19 in Nigeria were travelers from foreign lands or their immediate contacts. This informed the initial international travel ban for passengers coming from countries with high transmission, initially China, Italy, and Germany, subsequently extended to 8 high-burden countries to minimize rising imported cases. Ultimately, land borders were closed, all international flights were banned, and mandatory institutional quarantine and testing for international returnees to Nigeria was instituted on March 23, 2020, to reduce further importation of the virus from high-risk countries. Contact tracing and testing activities were ramped up in a bid to increase capacity for case detection and treatment.
Our goal is to introduce the COVID-19 vaccine in a phased and equitable manner based on advice of the World Health Organization and the experience we have observed other countries to make, and ultimately vaccinating all eligible Nigerians within the next 2 years.
We have to give an exemption to the arrival of the vaccines because we put a gateway to drugs coming from Southeast Asia to avoid substandard falsified medicines. So we have to give a special exemption for this vaccine.
On March 30, 2020, President Muhammadu Buhari issued a series of stringent non-pharmaceutical interventions, including stay-at-home order and cessation of non-essential movements and activities, collectively referred to as a lockdown strategy, in Lagos and Ogun states, and the FCT for an initial period of 14 days, extended for an additional 21 days in the same 3 states and later Kano State. The states were selected based on a combination of the burden of disease and their risk. The drastic lockdown measures came with a significant economic and social cost. Crime and domestic violence reportedly increased during that period, and many were unable to exercise their usual income-generating activities, with effects most pronounced on vulnerable populations and those living in poverty. The government, religious bodies, and philanthropic individuals began distribution of palliatives, an effort meant to ease the difficulty on affected persons. Upon completion of 5 weeks of a federally mandated lockdown, a gradual segmented easing of lockdown measures was initiated on the 4th of May 2020. This was a phased approach for an initial period of 2 weeks to create a balance between public health and economic consequences by progressively returning the population to normal activities. This easing of lockdown measures was supplemented by increased testing and contact tracing by rapid response teams, testing centers, and state public health department teams. The nationwide mitigation measures implemented by the government of Nigeria in the first 2 weeks post-lockdown includes an 8 p.m. to 6 a.m. curfew, mandatory use of face masks in public, a continued ban on interstate and international movement, prohibition of mass gatherings of more than 20 people, and mandatory testing and supervised isolation of at least 14 days for repatriated citizens. Slowly, Nigerians began to reduce commitment to safety measures. People began hosting parties, bars and nightclubs reopened, and some religious institutions did not observe social distancing during gatherings. The government began full enforcement, with President Muhammadu Buhari signing the Coronavirus Disease Health Protection Bill 2021, making the use of face masks in public places mandatory, among other measures, to further curtail the spread of COVID-19. Defaulters risk a fine or a jail term of up to 6 months upon conviction.
We don't preach so. I think we are recording like the amount of debt that other people in the other countries are recording. It will have sent a signal to every one of us that we have to buckle up and adjust strictly to all those things. Because I did tell people that government cannot do it alone. Each citizen should take charge of his or her own health.
Law enforcement agencies swung into action, and even popular individuals were not spared. On the 6th of April 2020, the Lagos State Police Command arraigned Azeez Fashola, popularly known as Naira Marley, and his manager, Seyi Awonuga, for embarking on non-essential travel from Lagos to Abuja and back to Lagos the same day for a musical concert. Naira Marley and his manager were fined 100,000 naira each by the magistrate. Another well-known face, Nollywood actress Funke Akindele, was also arrested for throwing a party in violation of the government's restriction on public gatherings. The actress and her husband, Abdulrasheed Bello, popularly known as JJC Skills, was convicted and fined 100,000 naira each by an Ogba magistrate court. The magistrate also held that the couple must serve 14 days community service and thereafter observe a period of isolation. Party goers and clubbers in Lagos were not so happy about the closure of nightclubs and bars. Many of them disregarded the law, and the police did not let them go unpunished. More than 200 fun seekers were arrested in different nightclubs across the state. In fact, the state government sealed 11 event centers and fun spots for flouting COVID-19 regulations. Strict enforcement had many adhering to safety protocols, and as cheering news to some, COVID-19 vaccines were now safe for use, and many countries began administering them. Different vaccines had been produced, and Nigeria acquired 3.94 million doses of the Oxford AstraZeneca vaccines. So far, 1.4 million Nigerians have been fully vaccinated. The WHO has advised that persons even fully vaccinated should still wear masks and practice all other safety measures.
We must keep stressing that the vaccine or vaccination does not stop you from being exposed to the infection and does not stop your exposure becoming infection, but it stops you from your infection developing into a disease. That is the point. And so we must continue to wear a mask so that we don't get exposed. The vaccine was not designed to stop exposure.
But here in Nigeria, it seems life has returned to normal. A walk through the streets will portray to anyone that caution has been thrown to the wind. Parties are happening, and large gatherings are ongoing without any attention paid to the fact that COVID-19 is not yet gone, with cases still recorded every day.
From the medical angle of it, we've seen cases of people who got affected, and they died, and it's been reported from time to time, here in Nigeria, not even all over the world. So I think the basic thing here is that as much as we enjoy the social life, in Nigeria, we just need to take precautions, because the pandemic has affected so many things, sports, entertainment. A lot of people have lost, so much, in their businesses, but whichever way it is, if we have to, go back into this lifestyle, it has to be done with precaution, absolute precaution.
In making matters worse, a new, more deadly strain of coronavirus has found its way into Nigeria. This is the Delta variant, which is more transmissible than the previous variant and has been able to resist the antibodies in human blood. It was discovered in a traveler after going through routine travel tests required for all international travelers. The Delta variant is of concern because it has increased transmissibility, spreading more efficiently than other COVID-19 variants. And in India, where the first case of infection of the variant was identified, it led to a deadly second wave in the country.
Those who ignore that there's no COVID-19, you can see some countries like India, Russia, they are still suffering from COVID-19. Even America is still suffering. Some parts of America, like the New York City. So they have not come out of the deadly wave of COVID-19 up to date. So we won't allow such to happen within our environment.
Two types of genetic component in terms of viruses. We have some viruses called DNA virus, or we have some viruses called RNA virus. And one of the characteristics of RNA viruses is mutation. I will cite some other ones that is familiar with us. Look at HIV, it's an RNA virus. We have influenza, it's an RNA virus. And this SARS-CoV-2 of major interest that we're discussing now, which causes COVID-19, is RNA virus. There's something we call, under evolution, we call survival of the fittest. You see, this organism too, they want to live, they want to survive. So if we now design a mechanism at which we want to stop them from being existing, as an organism, they want to look at some other means too that they want to survive. So from the process of dodging those mechanisms, that is one of the factors that leads to mutation.
According to a study published in April 2021, the Delta variant was 43 to 90% more infectious than the original virus. Governor of Lagos State, Babajide Sanwo-Olu, has raised the alarm over a possible third wave of the pandemic, following a sharp increase in the number of positive cases recorded in the last few weeks. He has imposed restrictions and sanctions since cases of COVID-19 confirmation had shot up to 6.6% over a period of 1 week. The development may not be unconnected to the careless attitude of air passengers from countries in the high-risk zones and reluctance of residents to follow the protective protocols issued by the government after the end of the second wave. Governor Sanwo-Olu disclosed that 18% of 50,322 air passengers of interest could not be reached for monitoring because they supplied wrong contact details. He ordered the sanctioning of inbound air passengers that failed to provide verifiable contact details, including accessible phone numbers. Airline passengers would face prosecution, including fines and imprisonment, in line with the Lagos State Coronavirus Law of 2021.
So what is our home-based care strategy? For those that may be asymptomatic or have mild symptoms that do not require admission into our isolation center, our telemed service, called the EcoTelemed, has been deployed to assist in the management of residents in the comfort of their homes. Available to reach on this toll-free line is 08000 EcoMed. 08000 EcoMed. or 08000 356 633. 08000 356 633.
Though efforts are being made to prevent another major outbreak of COVID-19 in the country, the lackadaisical attitude of many Nigerians toward COVID-19 is baffling. Some still don't believe it exists, while others just pay no attention to their safety.
The question is not about if the pandemic exists or not. I think the important thing is how we take care of ourselves and how we respect the rules and regulation from the health centers. It's very difficult for anyone to say he's aware about the pandemic in question. But of course, if the Europeans, the Americans, all over the World Health Organization himself, has given a number of times how people can prevent, not to be contacted in this kind of pandemic. So I think it will also be wise for us to, head to the instruction. If it exists, if not, I'm not the one to. I'm not a doctor, but of course I have to respect that.
For me, I just feel the Lagos State government have done so much for us to be able to stay alive till today, and God. And that is why most people don't think there is COVID, but I think there is COVID, and because of what the local government have put in place, that is why it has been easy for us to walk around and be able to do our normal business. But for me, there's COVID. A lot of people are dying. I've seen people being sick because of COVID. I even had COVID because there was a time I couldn't smell, I couldn't taste, and I knew I had COVID. So immediately I had to went to the center to get treatment, and I was okay.
A lot of us do not believe that there's anything COVID in Nigeria, but forgetting that we are blessed is just because of the way God loves us here, that we are not recording the death like every other cities in the world. Therefore, we need to adhere to the discipline, being absenting yourself from where the crowds are, washing your hands with soap, sanitizing always, and again putting on your face masks. So I believe when we do all these things will be okay with us.
If we relax so much, it's very, very dangerous. It means we are calling for the third wave, and that will give the virus the opportunity to mutate, because the vaccine cannot go at once for all. It's one after the other. We discovered that when the vaccine was rolled out, there were categories of people that will be vaccinated at time. So if care is not taken and people don't adhere to all these measures, because the vaccination process cannot go for all at once, it is likely we are calling for another wave.
A year ago, the world was coming to terms with a long, difficult journey ahead. 12 months later, the end of the pandemic is in sight in some parts of the world. Is it too soon to declare victory?
There is something called herd immunity. By the time we get the majority of the population from 60 to 70% vaccinated, then we'll be having just trace cases of COVID-19. Because once you get vaccinated, that doesn't mean you can't get infected, but it reduces the severity of the disease and there is less hospitalization. So it's easier for the immune system to respond quickly. And if there are other things, through empirical treatment, every other thing will be resolved perfectly.
When will the pandemic end? It is a question for which the world wants an answer.